Now the latest on the local response to the Ebola outbreak. Tonight we're hearing directly from the director of Rhode Island's health department about the preparedness of health officials here.
Earlier today we heard from a group of nurses concerned because they feel they aren't prepared for an Ebola outbreak should one happen here.
And that's a sentiment Dr. Michael Fine disagrees with. Eyewitness News reporter Kelly Sullivan joins us now live from the Department of Health with the Providence Mobile Newsroom.
Well, I spoke with the director of the health department this evening, and he tells me it's important for everyone to understand there is not an Ebola epidemic here in the state or in the U.S. However, if Rhode Island were to get its first case, the hospitals here are ready to respond. It's not a crisis in the U.S., but the Ebola epidemic is a concern.
There's an important reason that nurses are concerned, and we get that.
That concern and worry boiled over Monday when United Nurses and allied professionals released the result of a survey showing more than half who responded claimed they are not prepared to accept and treat an Ebola patient.
We have not had statewide drills. We have not had drills within our hospitals to test this emergency.
I had to differ. I think we're really on the forefront of our preparation.
We asked Rhode Island Health Department Director Dr. Michael Fine if there is a disconnect between healthcare workers and state leaders.
Absolutely not. As a state, we are very well prepared. Not every single healthcare worker has been specifically trained, but the healthcare workers who are on the front lines, they're trained and they're ready.
Initially, the focus was getting facilities prepared first, but also for months, Dr. Fine tells us information has been on the health department's website and emails have been sent out to healthcare workers. That information and additional training will continue to make sure all healthcare workers feel confident instead of concerned.
We're looking forward to working with nurses and all health professionals in Rhode Island to make sure everybody is and stays ready, because we think this is going to be a pretty long haul.
Now, Dr. Fine also tells me that Rhode Island hospitals do have enough equipment should the state receive its first Ebola case. He says it'll take time, resources, and people over in Africa to stop the spread of Ebola there. He says if they can stop it there, then it won't happen here. Reporting live with the Providence Mobile Newsroom, Kelly Sullivan, Eyewitness News.